Hello, dear colleagues. My name is Mynzhylky Berdikhojayev. My assistant is Berdikhojayev, and we are from Almaty, Kazakhstan. And the case number 4 for today, patient with multiple aneurysms. On the left side, it's a paraclinoid paraophthalmic aneurysm with a wide neck, and on the right side, patient has two aneurysms. One is paraclinoid, the second is supraclinoid ophthalmic segment. And now my colleague Davlet is doing 3D angiography for the right side, and patient is incidental. Aneurysms are incidental, and now we can see the right side. Just a second, I need to notice. Название нужно будет поменять. ICA Aneurysm. И следующего надо будет тогда cerebellar. Yes, we did a change in the queue of the patients. This patient with the aneurysm, but the title of the streaming is AVM. That's why now we will change, but I already sent this live stream link in the chats. One will be in discussional neuro course and second in neuroaddict. And we are so sorry. Now we will change the title, but it would be available after the change title. Okay, the 3D on the right side done. The wide neck aneurysm in ophthalmic segment, and paraclinoid is also wide neck. That's why we decided to place pipeline shield on the right side, and left side we will do next time. It's a intradural, that's why we indicated the treatment. There are 3 aneurysms, it's multiple, and patient under local anesthesia. Фенмен 27 бравишь, пожалуйста. Следующий ключ. Фен, пожалуйста. Фен. We took Fubuki 7 French. The anatomy of the aorta in this patient was okay, but Fubuki is quite soft guide catheter, and there is no so much support. Okay, let's change this. Yeah. Yes, we have Fubuki through the short cheese, and қорқпай жата беріңіз, жақсы ма? Мен Mynzhylky сайлаушпын. Қазір 10 жақ тамырға стенд қоямыз. Through the short cheese and Fubuki 100 cm. And the micro catheter will be contrast.
Contrast.
Yes. Micro catheter will be headway. Ана экранды қай жерге қою керек екенін білесің ғой, да? Зоя. Экранды қалай қою керек екенін білесің ғой? The same things all the time. I need to repeat as I'm coming time to time. That's why it's not so regular, and I need to say the tray should be here, the water is here, contrast is here. It's a Kaizen and it's very helpful. It prevents from extra movement, and then I can concentrate on the treatment. Yes, but all the time new assistant and all the time new anesthesiology team. It's a big problem. I think the regular AP and lateral is enough. We don't need to do so much manipulation with the positioning of the vessel. I think it's okay. We took headway 27 for the pipeline shield placement, and now now we are inside the aneurysm, and now we are in the MCA territory. Pipeline shield period?
Deeper in the English?
Yes.
Basement.
It's a 13 millimeter. The artery proximal is nearly 5 millimeter. I just touch with the wire this Y connector and everything is moved. I have reference image on the review screen, and now we can go with wire. It's in the supraclinoid segment, and now we're in the MCA. Yes, it's very good when you have a team. It's a teamwork. Okay, now we are in the MCA. Стентаж пересаж, пожалуйста. Pipeline. Джогаркса. Сона шар. Yes, we took a pipeline 475 by 20. It's the only pipeline for this year, and because of the proximal diameter nearly 5 millimeter, and I hope the pipeline will be nearly 5 at the end. We can place it safely. Just a second, we need to wait for the water. It's a shield, it's not a pipeline vantage, and the vantage was not available in our country, and there is a reason why. It was the first comments about the vantage, about the material, about the behavior and the fish mouthing during the follow-up. That's why we asked Medtronic distributors to not to bring the vantage in the country, and we kept the pipeline shield. It's more it's more reliable, and during the time the cobalt chromium technology. Yeah, тяжело идет. До конца. The cobalt chromium technology, and it's a good stent, but in the proximal tortuosity it behaves worse comparing with the nitinol based flow diverting stents. It behaves very stiff. It behaves as it wants to behave. will start to open. There is a silicone wings. We need to open nearly a couple of centimeters, and then stent is fell down. Now I think we opened the wings. It's a quite big stent for 75, and at one point it should open. As we don't need to open in the MCA, that's why we start to open in the ICA. Let's start opening. Okay. Distal is not opened, but proximal is opened. Okay, now it's opened. But we don't need to cover the choroidal segment, that's why the plan is to start to open at the PCOM segment. Now I think we are at the PCOM segment. Good PCOMs on both sides. Yes, it's a PCOM segment. It's opened at the PCOM. Now we can continue to open. Yes, it's a large segment. We can push. Yes. Delivery wire is a little bit stuck distally. It's not so comfortable. Okay. Now the wire is out. Heparin kettoydu. 5,000 units of heparin, and patient on ticagrelor 180 milligram twice daily because of the, I think the Verify now is not available. Verify недоступный же, да? Verify недоступный же, да? Или доступный? Yes, there is no cartridges for the Acometric Verify now system. Okay, let's do massage. Yes, now we're inside and we can push a little bit the stent. We're inside the stent. Okay, the stent is pushed as much as possible. Okay, and we covered the neck region. On AP it's clear. On lateral it's look like it's before the. Yes, it's opened. Минус. Вперед. Вперед. Yes, it's fully attached to the wall. It's a pipeline shield, that's why I'm not worried about the stent. The radial force is quite good, and on AP we covered the neck region, on lateral we covered the distal part. Let's do control angio. We put the timer on 2 minutes, and it's a shield technology. Usually there is no problem with this kind of folded water stent. It's less thrombogenic. Yes, now start stagnating inside the aneurysm. That's a good sign. Yes, we decided to place FD because of coils, and the braided stent should be placed. It's better to treat both aneurysm with one short. If it's possible. Stop. Is it? Yes, it's okay. Let's enlarge AP and lateral and like this. Yes, the system is not properly working. That's why time to time we need to switch for the review. Stent is finished here. FD finished here, and PCOM is here, just at the PCOM level. PCOM is functional, and supraclinoid segment is covered, paraclinoid is covered, no problem, and here is also no problem. The distal part is open. Okay, now I will ask David to do control CT, and on minute 15 he will do control angio. If everything will be okay, then David will show thumbs up. Okay. Okay. Къде же север? Къде да север?
Жоқ, бірінші ол арты бақылау кетеді.
Қалайсыз? Жақсысыз ба? Стентіңіз қойып қойдық оң жағында, жақсы. Ауырып жатқан жоқ па? Болды, қазір 10 минутта Құдай қаласа бітіреміз. Жақсы? The colleagues CT is ready. Now you can see the pipeline distally, and the brain is normal. I am now finishing the audio stream, and David will continue video stream. And in 8 minutes will be control angio, and if the stent will be clear, brain is okay, then we will finish, and the next case is cerebellar AVM. See you in next 30 minutes. Thank you.